health science technology is a two-level program. So students can apply at the end of their sophomore year. They will take it junior year and senior year. So we call them level ones and level twos. Our level ones will have an introduction to kind of the healthcare system. So we're going to cover personality, teamwork building skills, kind of like what we need to have for a character to be a healthcare worker. And then we will go into the healthcare exploration. So students will be able to take a broad view of all the different disciplines, career opportunities that they have in healthcare. So some of them can be hands-on, working with patients in occupational therapy, physical therapy, nursing, doctor, physician assistant, nurse practitioner, or they can go the route of working kind of outpatient in some of those disciplines, the same disciplines, but also in dental or veterinary science. They might want to do modalities such as X-ray, radiological technician, or ultrasound. They might want to go specific into working in a doctor's office or an MA, but they also might just want to be a medical secretary or a medical assistant, or work more in with patient information, but not necessarily patients. So we kind of give them a broad overview of the different opportunities that they have in the healthcare field.
The two ventricles contract simultaneously, forcing blood into arteries leading to heart.
So there's level one and level two, and all the curriculum is going to be the same across the board for the juniors and the seniors. The only difference is second semester, senior year is when we split off and we have our cohorts. So we have LNA cohort, EMT, and allied health. So they'll get 60 hours for allied health out in the community industry, whether it's in Plastow, Salem, Wyndham. We have a few students placed over at Holy Family Hospital. And then our EMT program and our LNA program are both industry recognized credentials. So they'll end up with a license if they choose to, and they complete the program afterwards.
It's a 2-year program. It's a CTE program, and I feel like the first year is mostly bookwork and some skills here and there, and then the second year is mostly skills.
First year we go over like A&P, anatomy and physiology, and we also learn like history of healthcare, all that kind of stuff. And then your second year you kind of keep going with A&P, and then everyone kind of makes their own decision. There's like LNA, EMT, and allied health, and like depending on what you kind of want to do in the healthcare field, you kind of pick your specific. LNA is a lot of skill work because we are like patient care, it's a lot of that, and we also do clinicals because that helps us to get our LNA license.
You learn a lot on how to interact with other people, so it's great skills overall. I never knew how it worked, I never knew what it was like, but after this program you definitely feel more comfortable, and you definitely learn on what it's like to be in a hospital setting for not only a healthcare worker and provider, but also a patient and what that feels like for them. So you develop a sense of empathy and understanding.
We try to simulate what they're going to have in the hospital setting. So we do have now, granted in the hospital, most of the patients have their own rooms, or if they do, they are separated by two, they have two beds and obviously a doorway. So we have the patient curtains, we have our beds that are fully functioning. These are basically if somebody answers a call light and the patient says, I need to go to the restroom, or can you reposition me in bed, or I want to get out of bed into the chair, or I want something to eat or drink. The information that's checked off on here gives that caregiver the knowledge to be able to safely take care of that patient. We do a lot of patient scenarios where we will have a student be a patient, and then there's a skill that needs to be done. So we do intro skills. There's a certain skill that they have to do at meeting our Board of Nursing guidelines. We prepare them and do practice skills for clinical, as well as being tested at the end of the semester. And then we actually will do a debriefing. So a lot of times we'll have a couple of people volunteer, then other students will watch what's going on, and then the student gets to reevaluate what they did and what they would have done differently to make it better, and then the other students add their input in. So it works out really well, but most of the time I've got 5 beds and I have all 5 stations going, and then students have their skills that they're working on. And so then I'm going around and I'm assessing their skills, making corrections, and helping them understand what they need to do. They have have pulses, they have heartbeats. We can straight cath them to get urine from them. We intubated them, and we can do assessments, blood pressures, blood draws. They have different pupils. I can put them, they can have tongue swelling. They can feel the pulse here, and they can say, yep, the pulse matches that. So they can feel the pulse here, they can take a blood pressure, they can listen to the heart, they have bowel sounds. So I can change this over, I don't think I have her hooked up, but, oh, maybe I do. So it says fetal, normal. So as a joke, I'll do this, and they'll be like, Mrs. Cook, I hear it like, it sounds like there's a heartbeat. And I'm like, why would you hear a heartbeat in the abdomen? And so they're like, oh, could she be pregnant? Absolutely. I can change the heart rate and put it up to 120, and it will change. And then I can put up their respirations. They should recognize, because they're abnormal vital signs, that the patient is not doing too well on that. And so now an alarm is going off. They'd be able to tell you this is an ulcer or necrotic tissue. We have another ulcer on this side. If I rolled her over, you could see it. And they've got deep tissue ulcers, pressure ulcers on the heels. These are arterial and venous ulcers. We have simulated blood. We'll hook them up, and they actually will be able to draw blood from our veins. So we have veins that they can draw blood. They can start IVs. We give injections. So they'll come out on, when we come back on Monday, and we'll give injections into the thigh for the epinephrine injections for anaphylaxis. We have shoulders. We can inject into the shoulders as well for deltoid injections. Look at the tip of your needle. You're going to see what we call a bevel. So a bevel is a little slant with an opening. Okay? Whenever we are going to go in, like horizontally against something, flush against something, you want that bevel to go up towards the ceiling. In order to get them to understand when we're working with needles and needle safeties, we did precautions, standard precautions yesterday. So that was gloving and gowning, putting on all of our personal protective equipment. So making sure they put it on correctly, making sure they take it off correctly, kind of putting all of those steps together. We did medical asepsis and surgical asepsis last week. So they were using their clean technique, using antiseptics today to wipe things off and prepare their syringes. And then it's just fun. It's fun for them to be able to see the tools that maybe they watch on the shows or understand what some of the language is, and then being able to apply it, and then they retain it. So we did the hot dogs because it simulates the skin as close as we can to a human. So what they were doing was taking their syringe that was filled with whatever the solution would be that they would be using. It's obviously not real medication. It's from demo dose, so it's a simulated solution, and they're injecting it under the skin, and then they would form a little bit of bleb. And now in real life, you would come back in 48 hours to see if your skin reacted to that solution or that medication that they put in. So right now we were just trying to show them transdermal is just a little bit under the skin versus subcutaneous, which is going into the fat tissue, that adipose tissue, which we learned last week, which is only a small little needle. And then we have intramuscular, which is another one of their medical terminology words. That's when we slipped over and we used the flesh skin. And that was in the side of the muscle, and the different lengths needles that we use.
In EMT specifically, we learn a lot of, again, emergency medicine, dealing with patients in the field, how to do things, what way to do things, and in what order, because you want to essentially assess life threats before anything, because even though there are other injuries, you can't just first come, first serve, because there are other things that are more pressing.
So now we're trying to get through all of the criteria, all of the curriculum for the specific EMT course. So we're doing trauma, cardiac, airway, oxygen, breathing, obstetrics, pediatrics, all of these big topics which are really focused on specifics they need to know, but understanding that they have to have the background and the sort of anatomy, physiology behind them so that it all makes sense.
So to set up the oxygen tank to give oxygen to patients, you first want to clear the dust out of the tank by opening it slightly. And then you apply a pressure oxygen regulator. tighten it around the valve. And then you want to do 2 full twists to open the tank. 1, 2. And then you can adjust the edge to release however much oxygen you need. And then you can connect nasal cannula to it and apply it to a patient by just twisting this, and then it'll slowly travel to the tubes into the patient's nose. We learned patient assessment, so when we show up to a scene, exactly what to look for, what to ask for, the steps to go through. We learned basic skills like splinting, preparing oxygen, controlling the C-spine, rolling onto a spine board, transporting everything that an EMT would need to do so that when we take our test, all the practical stuff we need to do, that we can do it efficiently.
Here is the yank hour machine. This is used to suck any unwanted debris out of the patient's mouth to clear their airway. And you're just going to do that for a few seconds to clear any debris that's in there. This is a nasal cannula used to also help with the airway. You would put a little bit of lubricant on it and then insert it into the nose like that, and then it will go all the way through and into the mouth and clear the airway. And then we use one of these to hold the tongue back, and then you just kind of go upside down and then twist it around, and then that holds the tongue down so that air can pass through freely, and if the patient is unresponsive and not breathing, it'll help them start to breathe again.
So when attaching it to the patient, you want to put the oxygen tank down so it doesn't roll off the table. And then attach the nasal cannula to the person's nose, and then up around their ears and underneath their chin. Like that.
Someone get me up.
Hello, sir.
I can't move. Oh, help.
Hello, sir.
Oh, yeah, help.
What's going on?
Oh, I crashed.
I wanted to give them a bit of a taste of what it's like to be in a setting where the trauma has occurred, and like look at the scene and everything that's going on, and then have other distractions as well, and then see how they go adapting when they find things that they haven't seen before, and also working together. So it's a really useful teaching tool because we find out what they don't know, what they're good at, and expose them to new things as well. It's also a lot of fun.
So we responded to a call with a patient that was ejected from a vehicle. So that's a major mechanism of injury. So basically it was kind of to just go over the stuff we've been reviewing in class. C-spine procedures, we just did rapid trauma assessment on top of possibly splinting on the way, airway management, and then just really getting used to that practice because there's really no other way to do it.
So we were called to a motor vehicle accident where the patient was ejected from the vehicle, and we responded with just 2 EMTs at first. And then as soon as we got there and realized it was as severe as it was, we called for backup and we got him off his little scooter thing. And then we made sure to keep his spine stable because it was very important to keep that part of him stable so that we didn't cause any severe damage to any motor function. And then once we got everything stable and we did a rapid trauma assessment, we were constantly checking vitals, we got him ready to transport, and then we brought him upstairs.
Respirations, are they normal or is he breathing normally?
We said 22.
Okay.
What I was really impressed with was how professional they were and how well they worked together. They all communicated really well. They knew what they had to do. They went through all of the steps well. They missed a couple of things, but generally all the important stuff, life-saving steps, stabilizing the spine and checking the airway and the breathing, and like treating the patient and being professional with the interaction and communication with the patient was all really impressive. You guys showed up. Was my airway open? Yeah, I was talking, my airway was open, and you went straight to C-spine. You guys were doing that. No one was freaking out, no one was screaming.
What's important to remember when you are dealing with a scene like this?
Definitely to stay calm and communicate is one of the top things, and also just to make sure that you're covering all your bases, checking everything, asking questions, that sort of thing.
I'd like to think we got on scene pretty fast, at least with how far away he was, and we did really good stabilizing the C-spine, and as far as rapid trauma assessment goes, that too.
A lot of people who take it here are using it as a stepping stone, getting experience on an ambulance department or a fire department, so that they can then use that to get into pre-med, to show that they're really interested, that they're committed, and that they've got this background already and they know what they want to do and they're excited. So a lot of people are doing that, using it, sort of moving down the medicine path. But there are some people who are really moving into emergency medicine as a career itself, so they know they want to do this. There's one who knows they want to be a paramedic, and there's a couple, I think, who want to do emergency medicine, so they will stay and probably get a lot of experience doing this before they, move proper into emergency medicine physician.
This is a great stepping stone, and especially to get that practical side of it down, being able to just have a general outline of the way things present, even going into something like med school is really helpful, on top of having the opportunity to do a lot of clinical hours in college, because I will hopefully pass the EMT exam and get my license and be able to practice in the state of New Hampshire.
So after high school, I'm going to college to major in biology pre-med, so the end goal would be some sort of ER doctor, but I definitely am going to try to work as an EMT amongst everything.
So I'm going to UNH for my undergrad, and then I'm going to med school, so I'm planning on being an endocrinologist, so physician, yeah.
We do a lot of hands-on learning, try to do a lot of learning with scenarios, because a lot of EMT classes you'll find do a standard PowerPoint presentations where they're just learning material off the board and memorizing it, and then do a test at the end. And I really like them to get experience as realistic as possible, showing them what they're going to be exposed to, which is pretty confronting sometimes, being a high schooler without a whole lot of life experience, going out and seeing things that are pretty graphic sometimes. So I like to kind of gradually expose them to some of those things, and then sometimes surprisingly so. And it gets them pretty excited as well. So I like to use equipment and put them in situations where they're like, this is really fun learning, things that they see themselves doing, that they get excited about, and doing those instead of just our written learning.
Mr. Welsh is great. He does a lot of hands-on scenarios like today, and it's definitely a really interesting but amazing way to learn.
It's a really fun and just good environment to be in. Everyone in there wants to be there, wants to learn, and yeah, Mr. Welsh is great too.
Love it, love it. I recommend Health Talk for anyone who's looking to get into any kind of medicine, or even if you're not getting into medicine, really like being able to connect with people and stuff like that helps so much.